read it and she like kind of can't even stop muttering her own like thoughts that you would usually think in your own mind. Like she says it out loud, like the coagulation of the blood, and like she kind of like pressured speech maybe, or so maybe like a
Sure.
I don't know.
Okay. Can't rule that out. So you're identifying goal-directed behavior, perhaps as part of a manic state. Rule in bipolar 1 disorder.
Going off of that, I think we can also notice some grandiosity with regards to her thinking that her itself is this intense beauty, it's being the fairest of them all, and going to extreme lengths to maintain that status.
Sure. So there's grandiosity. It's the fairest of them all. The other thing I want to point out here is irritability, right? A little bit. Irritability is a required feature. Remember, the required feature to define a manic episode, which itself defines bipolar 1, is an elevated, expansive, or irritable mood. And she's definitely irritable. So she definitely has the necessary feature. Now we're going to look at dig fast to see if she has the remaining features. Now she does need a total of 5 because irritability is less specific than elevated. The other caveat here, though, is that similar to test taking, when we analyze films, we don't need to have that specific threshold. In clinical practice, you do. But when we are in an artificial situation, analyzing a film, taking a test, it's single best answer. So in this case, if on a clinical vignette on your shelf exam, you had someone with clinically significant irritability that also manifests grandiosity and an increase in goal-directed behavior, single best diagnosis, well, you wouldn't leave the answer blank when you had bipolar, major depressive disorder, schizophrenia, somatic form, or somatic symptom disorder, right? And you certainly wouldn't leave it blank and then think to contest the question saying, it's really not truly bipolar because there's less than 5. You're going to lose that argument. Single best answer, we're going to apply those same standards to film. So I'm not going to be worried about us actually reaching 5. Certainly the 3 that we have warrants a clinical discussion about mania, and therefore bipolar 1. You have to, again, clinical pearl, as well as something you could definitely see on a shelf exam. You have to know that any individual, real or on your shelf, who has a manic episode is likely bipolar 1. Whether they have alternating episodes of depression or not is irrelevant. Mania equals bipolar 1. Of course, the mania cannot be induced by a substance, and it can't be caused by an underlying medical or neurological disorder, like multiple sclerosis. That's obvious. We discussed this in several contexts already. This applies to mania as well. Once we understand that there is only a single condition that you can diagnose instead of bipolar 1 when there's evidence of a manic episode. What is it? The only condition that exists in the DSM that you can diagnose in lieu of bipolar 1 with evidence of a manic episode is? Right, exactly. Say it again. Perfect. Schizoaffective disorder, bipolar type, is the only time where you can actually choose that as your single best answer, whether it's in clinical practice or on your shelf exam, with evidence of a manic episode. In every other case, when mania, bipolar 1. What is hypomania?
My understanding of distinguishing mania from hypomania is that hypomania is a lesser form of mania. So typically, they'll stay awake, they'll still have high energy, but they won't be doing things as drastic or that would result in them, likely being hospitalized.
So what I'm hearing is that hypomania, with regard to signs and symptoms, is exactly like mania. However, qualitatively, the individual is not experiencing any clinically significant distress or impairment. That's true. And it's only one of two illnesses in the entire DSM that is defined through a lack of clinical significance. Right? Anytime we use the word disorder in the DSM, clinical significance is mandatory. The reason why it's not called hypomanic disorder is because, by definition, individuals with these signs of mania are not experiencing clinically significant dysfunction. Right? By the way, nothing to do with this film, but what is the other condition that is literally defined through a lack of clinical significance? Only one more. Mild neurocognitive disorder differentiates from major neurocognitive disorder by that very, very criterion. Same thing. How does minor depression differ from major depression? Oh, by the way, before we leave, hypomania, not only is it qualifiably less severe, but quantifiably it is too. It doesn't reach the magic number of symptoms needed to make the diagnosis. So there's both quantifiable as well as qualifiable differences. Minor depression separates from major depression similarly. When an individual has less than 5 SIGI caps, they have minor depressive disorder, even when clinically significant. Right? So it's really a quantifiable minor depressive disorder.
Would you say the time course is also different?
Minor depression, I do not believe so. Correct. And thank you for bringing that up, because you just actually, I have to go back and correct something I just said. I misspoke with regard to hypomania. Hypomania, it is true, qualifiable. I think we understand that. Quantifiably, it's number of days, not the number of symptoms. Magic number is 7. 7 days, mania, less than 7. Hypomania. So the actual number of symptoms is the same.
My understanding now with DSM-5 is that regardless of the time course, if hospitalization is a component, then by definition it's made.
Perfect. Qualifiably, if your patient is sick, that trumps everything, right? And think about it, as a clinician, if they're having manic signs and symptoms, and they're actively psychotic as a result, and as a result, high-risk behaviors, they're actually trying to pilot a plane. And this has been going on for 4 days. There is not a clinician in this world that would say, you know what, let them fly the plane, and if they safely land, 2 or 3 days from now, when it reaches 7, have them see me. There's just no way that's going to happen. So the intensity of symptoms, the quality of symptoms, aka clinical significance, trumps the actual number of days. And this is also something that the DSM actually writes in, because many times people who are acutely manic and try to get on a plane to fly it are hospitalized. And they actually will say, either they reach 7 days or are hospitalized. Like that could be within 7 minutes. That's mania. It's a good point. All right, so our queen looks like she may actually have bipolar 1. By the way, when hypomania alternates with major depression, so discrete episodes, 3 to 6 months out of the time, either major depressive disorder or major depressive episode. 3 months, 6 months, individual comes back down to baseline, maybe has a period of euthymia, then a hypomanic episode. 3 months, maybe back to baseline, maybe even flips to the opposite pole, right? Depressed again. What condition? Bipolar 2. Bipolar 2 is the combination of a hypomanic episode with major depression. What then do we call hypomanic episodes that alternate with minor depressive episodes? Cyclothymic. That's cyclothymic disorder. All right. So make that 2x2 grid. Right. Mania, hypomania along your x-axis, major minor depression across the y-axis, fill it in. Quadrants 1 and 2, or I should say column 1, because mania tops the column, will have to be bipolar 1. Anything with mania on top of that column is going to be bipolar 1. Any questions? Any other observations in Snow White beyond the Queen?
My interpretation, I think this is a little off on a limb, but I sort of saw Snow White as maybe having a brief psychotic disorder. So I guess to explain myself, the sort of inciting event was the basically murder attempt on her by the Queen's henchman, I guess. And after that, you see her escape into the forest, sort of in distress. And at that point is when she begins seeing these animals engage in sort of sentient behavior, where she meets the dwarves, which are not really clearly like normal humans, and it seems like they could be hallucinations. And furthermore, she says goodbye to everybody at the end of the film, essentially. So it seems to me like she's saying goodbye to all her hallucinations, and her walking back to the castle at the end of The Princes, maybe a representation of the end of a psychotic episode, but that's just an idea.
So what she experiences in the forest then would be a product of her own mind. And since it is incident to an attempted murder, and that stressor is in place, brief psychotic disorder would appear to be the single best diagnosis. That's what we're saying?
I think so. I think psychosis is present. Brief psychotic disorder trumps acute stress disorder, but correct me if I'm wrong.
Yeah. Oh, yeah. No. I agree with you there. 1 day to 1 month. Do we have any evidence that she is in the wood beyond 1 month? I'm not sure.
Seems like it's only a few days, but
Hypothetically, if this went to 33 days, beyond 1 month, what might we call it? Schizophreniform, right? Psychotic features that persist beyond 1 month, but less than 6 months. And what's 6 months or more? It's schizophrenia, right? Question. Patient, so first I'm going to give you the trick question. With regard to your evaluation of a patient with new onset psychosis upon or incident to an attempted murder, you provide a full H&P psychiatric evaluation, and you have a preliminary diagnosis of brief psychotic disorder. The family is going to ask, hey, doc, what's the likelihood that this is schizophrenia? And the way they ask the question is, what percentage of brief psychotic disorder evolves to schizophrenia? Trick question. The reason why is because, by definition, brief psychotic disorder always ends before 30 days. And if it does go beyond 30 days, you were never treating brief psychotic disorder to begin with. You were treating, at the very least, schizophreniform.
So then the question is, how often is this diagnosed, or just, I mean, it's like criteria, like, right? So, I don't know, how would you phrase that?
So that's my question. Thanks for the ping pong pimp. So the question then is, as a clinician, what do you do? Because we're not going to play trick questions with our patients, and we still have to get to the root of the patient's question, even if on an exam the question writer might write it in a tricky way, where the answer would be 0. What is the most important factor to look at that might allow the clinician to identify that what they are currently evaluating is not brief psychotic disorder, but instead early schizophreniform, or perhaps even early onset schizophrenia? So let's say the history's absent. Yeah, so let's say the history's absent.
Do like a more insidious onset?
So the more insidious onset, that's true. The trauma would certainly be much more consistent with the brief psychotic disorder, where a prodrome would be more consistent with schizophrenia that you somehow were able to catch within the first 30 days. What else? That's the biggest one, yeah. In addition to that, negative symptoms. Negative symptoms are not defining of brief psychotic disorder, and if they are observed during the brief psychotic episode, that episode is much more likely to be due to a larger disorder, schizophreniform versus schizophrenia. That's it, right? So definitely get the history, no doubt. Past history of schizophrenia, slam dunk. But also think trauma, stressor versus prodrome. And if that can't further clarify, negative symptoms, and then everything taken together. And even then, there's going to be outliers. So when you talk to the patient and their family, make sure they understand your medical opinion and how you're generating it with regard to your observation of there being the absence of a stressor, but what appears to be a prodrome, very often misdiagnosed as depression because of the social withdrawal, as well as anhedonia and some alogia, which do appear to be consistent with negative symptoms of schizophrenia. So make sure that's the way you actually formulate the patient's psychosis, then identifying the provisional diagnosis.
Would you say that brief psychotic disorder would be ruled out until you could retrospectively look back and say that it was a brief psychotic disorder and diagnose it?
No, I mean, I would always present it as a provisional.
Provisional.
Yeah, I mean, we're struggling with something between 1 day and 1 month, and I feel comfortable saying that it is within that time frame because there does not appear to be evidence of a prodrome. And to further support that, there does appear to be evidence of a stressor. So use the word provisional. Now again, my strength in the provisional has everything to do with the presence absence of prodrome, as well as the presence absence of the stressor. But I always present it as a provisional. And a caveat, some indicators are here to suggest that we might have to deal with a more chronic illness, specifically the anhedonia, and maybe even the attention deficit. Though part of those 5 A's of negative symptoms do appear to be present. So this might proceed not only beyond 30 days, but even chronic. In psychiatry, when we use the word chronic operationally, we mean 6 months or more. Snow's kind of young. It's concerning because she's a little young, but certainly schizophrenia onset, especially the prodrome, it's not too far from her age. So brief psychotic, do we see any negative symptoms in Snow? I mean, can we get into this conversation now of our main character? Again, I am a little reassured that there does not appear to be a prodrome. Although I think the movie does start out with her talking to the birds, though, doesn't it? So I don't know how to interpret that. But otherwise, in the absence of a prodrome and the presence of a stressor, this is one that's a provisional. We'll have to watch this. By the way, is there a sequel to this? Snow White 2? Does she turn out to be schizophrenic? She can need to interact with animals, sing. All right. Anything else with Snow? With all of the above, everything we just discussed as part of our differential, what must we always have to address, evaluate for, and rule out? Right? And/or? Right? Anything medically going on here? Well, let me restate that. Is there anything that Disney explicitly writes into the script with regard to an underlying medical condition? A lot of pallor?
Yeah.
All right. I don't know if I'd be comfortable saying definitively no. So we're going to get a CBC. Now, I don't know. I guess if she has a macrocytic anemia and she has severe B12 deficiency, it might be contributing to her psychotic symptoms. So, all right, we're going to get you sold me. We're going to get a CBC. All right. How about substances?
The apple reminded me kind of that.
How come?
It said And then also just afterwards, she's seeing dwarfs. Seems to be kind of not have an altered mental status.
Yeah. Could certainly be symbolic. And again, her reaction to it, we probably consider it a CNS depressant. And therefore, sedative hypnotics would be in the top of our differential. Let's divert just off course a little bit and talk about the origin of Snow White. Whether it's from the children's book or whether actually the not so children's book or the Disney film. How was snow created? What's that?
Water freezing.
No. I mean the character.
Oh, okay.
You're getting too scientific for me. How's she conceived? She's conceived by a noble lady who cannot bear children and wishes for a child. Right, so there's the magical element of this. And she specifically describes the characteristics of snow. I think she's sewing. She pricks herself with a needle, and a drop of blood falls on a black window pane. And she said, I'm going to get this wrong, and I'm going to get it out of order, but I wish I had a daughter. Lips as bright as blood, her hair as black as ebony, windowsill, and skin as white as snow. That color scheme has been the subject of a lot of discussion with regard to not only psychology, but anthropology. And it gets back to the real folklore of this story prior to Disney ever getting its hands on it. So I'm not going to go through the whole idea of purity, death, and rebirth, right? So it's white, black, and then red. And there's a lot more to it than just a quick one-liner. There's major essays written on this. Suffice it to say, the colors play a major role in understanding the story of Snow White, whether it's the original or whether it's the film adaptation by Walt Disney. But you'll probably notice that the clothes Snow wears also have very consistent colors. Primary colors. What colors does she wear? Yellow, blue, and red. Okay. Any idea, street slang, if you were to ask for reds, blues, or yellows on the street, what drug you're likely to be trading for? It's a benzos. Right. So taken from the idea that the color scheme in this story is at the base of understanding Snow White, just diverting your attention from the obvious, the way this movie starts. Okay, white, black, red, and looking more at the other colors, the ones that nobody talks about, the blue and the reds, all happen to be street names for benzodiazepines. There's also, did you notice there's also one animal that she seems to talk to the most? Any observation there? More specific? The bluebird. Yep. The bluebird happens to be a fourth street slang for benzos. So not only blues, but bluebird. So we might begin to think that you being on board with the apple being synonymous or indicative of a sedative is not too off base here. She does react in a way that we would assume this to be a CNS depressant, and more specifically, likely a benzodiazepine, pretty much synonymous with her color scheme. Right? Blues, bluebird, reds, and yellows. Other thoughts about Snow White the character?
I don't think this is a psychological thing, but I did feel like, something that I didn't notice when I was younger that I did watching it with her, is that she's very bossy. She's like, she'll be like, no food unless you clean or you wash your hands or whatever. Or,
No doubt. Yeah, she's definitely not a passive character. No doubt. Question?
I'm sorry, I was just thinking in my head.
Okay,
I can't
you're allowed.
about her. I feel like she was a little bit thinking so much about wanting to be carried, like she wanted to be carried off into the sunset or like find someone to be in love with, and I found that a little concerning for how old she was. So I wondered like there might have been some like trauma or something that happened to her in the past.
So let's call that precocious. Have to consider, which would be the first thing we always should consider, is whether or not this is culturally sanctioned, right? Because we're sitting in New Jersey during a new millennium, and we're beginning to decipher and analyze behavior of a prior century in another country. So we have to have a little bit of humility to make sure that we're going to be accurate with regard to how we describe this particular behavior. So with that in mind, let's say we can definitively rule out that this is culturally sanctioned, right? We talk to family friends and they tell us, no, this is precocious. And the reason why I want to do that is because to not do that, we're not going to reach a teaching point. So let's assume that this is something that is not culturally sanctioned. So you actually brought up the idea of trauma. That would be certainly in a differential diagnosis why a child would need to grow up as quick as Snow appears to have grown up, right? Losing her childhood, right? Needing to be an adult. What aspects of this movie, now, if you're watching it with that frame of reference, can you identify that perhaps supports the idea? She lives alone?
Well, I'm assuming that, but in the movie she was like,
Do we see her parents at all? None?
oh,
Okay, that would be a concern.
is the queen is related to her though, right? Or is she?
Is she?
Mother, step.
Oh, okay.
What do we know about her stepmom?
She's the queen?
The queen is her stepmother.
Oh, I don't know, I'm
I
not
believe
seeing
in the original.
Okay.
I think the original.
Whoa. Sorry about that. For those following at home, hope you didn't sustain any injury. Okay, so the queen is her stepmother. Where's her dad? Is he dead?
I feel like in the Disney movies, if the dad's not around, he takes presumably he's dead. Like there's a dad with another wife somewhere.
Yeah. So somebody double check whether or not dad's still alive. We need to talk about the queen / stepmother motif here.
I was looking at average age of marriage in Europe in like the 1920s and 30s, so it was like late teens, early 20s.
So this is not culturally relevant, right? Do we know how old Snow is? 14. You said the average age of marriage?
Late teens, early 20s in Europe in the early 19th century.
Oh yeah, so it says, Snow White's mother died shortly after birth. After some time, her father became remarried and being born her queen. Not long after the marriage, her father suspiciously died.
Suspiciously. Oh, let's see, that even throws a little bit more onto the fire. I think in a story, her mom died of childbirth, right?
Yeah.
Is there any reason to believe that she doesn't? So let's talk about the evil stepmother. Earlier this morning, we talked about Sigmund Freud. I don't want to leave the analytic perspective of this. Any thoughts, any guesses as to the Freudian interpretation of the evil stepmother? Growing up, we all believed mom was perfect. That's normal. Right? It's a defense called idealization. We've all believed that mom was perfect. One day, when we turned around and needed her, she wasn't there. And all of a sudden, our world changed. Things were different from that point on. Mom was no longer perfect. Some children cannot tolerate this. That's trauma, but it's also developmentally appropriate trauma. We've all experienced it. There's different ways in which the child soothes or self-soothes. These are called Freudian defenses, right? Freudian defense mechanisms to alleviate the anxiety upon the realization that mom cannot be omnipresent. One way to self-soothe, one way to actually alleviate that very anxiety would be through the defense mechanism of fantasy. Right? What is fantasy? Fantasy is defined as the autistic retreat into an inner world, so as to protect oneself from the harsh realities of the real world. Right? Basically, a living in a land of make-believe in your mind. It's not full-blown psychosis. It's a defense. It's a subconscious process. Normal. Can you give me an example of fantasy in that child who realizes one day that mom is not perfect? Mom is not omnipresent. She actually has a life that requires her to sometimes step outside of the room I am in. It's true, believe it or not. Perfect. The imaginary friend is a great example of fantasy. So is the tea party. Right? Make-believe tea party. Anybody here have kids? Self-disclose? Okay, you'll get there. You'll walk in, your child will have a tea party. I'm going to give you a 100% certainty there's no tea in those cups. And I will give you 100% certainty you will sit down for several minutes at a time, and you will enjoy that no tea in those cups. And you will make sure that your daughter or son is happy with regard to your participation in the tea party. It's going to happen. You will tuck in your child's imaginary friend. It's a little creepy, but you will do it. When you do all the above, do not call me. Right? It is normal. Right? It's a normal way in which an individual, 3-year-old, 4-year-old, is trying to overcome that anxiety that mom is not perfect. There's another process here called splitting as well. What is splitting? Good. Right. Perfect. Right. So splitting is the idea that people, places, and things can either be all good or all bad. When you combine the two, what do you get? She can't tolerate that mom is imperfect. So she creates an imaginary friend. And through splitting, that imaginary friend can take on all of mom's negative attributes so that my mom can remain perfect. Hence, the evil stepmother. There is no evil stepmother in this film. It's a product of Snow's imagination. The question then becomes, has anybody else discovered that mom did not truly die at childbirth? But instead is symbolically dead to Snow White. Why does Snow want to kill her mom? And what does it have to do with her dad mysteriously dying? You're following the breadcrumbs, right? Did I say that so much? There is no evil stepmother in this film. The evil stepmother in this film is an imaginary friend. It's an imaginary friend that is conjured in the mind of a young girl, perhaps aged inappropriately. She is 14. As a result of two defense mechanisms, fantasy meets splitting. It is the unconscious way that this little girl will be able to, number one, create an imaginary friend that through splitting can contain all of mom's negative attributes. therefore keeping mom pure. Now, let me backtrack. Let's say mom is dead, and that the evil stepmother still, though, is a product of Snow's mind. What might actually have taken place with regard to early childhood trauma, because somebody said that before, that fits very neatly with what we just discussed?
We have to attend our piece, and we need
You go.
2 minutes.
2 minutes? All right, well, I'll give you the answer then. I'll give you the single best answer. Somebody said that she was precocious, and then the differential diagnosis for her being precocious is early childhood trauma. This early childhood trauma was likely perpetrated by who? Said letter? The father. She became very angry at mom. You're not around. You abandoned me. Children do think that death equals abandonment. You abandoned me. You were not here to protect me. So she kills her father. He died mysteriously. Mom does die at childbirth. That's the abandonment. And now we see this young girl struggle with regard to these feelings, these very ambivalent feelings about her mother, and therefore, as I described before, the creation of the evil stepmother, where she has this imaginary friend that she's able to split, and it embodies all these negative attributes, including not wanting her. Right? Why did mom die? She didn't want me. Well, that's too threatening for a child to admit, to bring to conscious awareness, but instead may safely attribute that through defense to the imaginary friend. And because of this, there is reason to believe, because of all this anxiety, remember, all these defenses, hallmark anxiety. She's also self-medicating with benzodiazepines and overdoses, symbolic by the apple. The dislodging is itself symbolic of a medication we'll end here called flumazenil that will appear on your test. Right? Reverses benzodiazepine overdose. We'll stop here. Good luck with PCM. For those following at home, we're going to take a brief break, 10 minutes, and we'll come back with our case conference.